Just in the last 8 years, malaria cases in Asia have dropped by 50% and mortality rates by 80%. And this is unprecedented. This means we have better trained healthcare workers and more efficient health systems in place to identify and treat malaria. We can't let our guard down. We need to end malaria now. Never before have we been this close, and never before have the stakes been higher.
Gains in malaria have been precious, but those gains are also precarious. The slightest lapse in our resolve, the smallest stutter in our response, could reverse decades of hard-won progress.
We are honored to work together with the civil society and the government to improve healthcare in particular, because of this is not only government responsibility, but ours too from the private sector. We also encourage more businesses in the private sector to contribute and get involved more actively, not only locally, but also globally if possible.
Business have a disproportionate role in driving various initiatives and driving business practices. Our responsibility and our impact cannot just be the people who we're directly interacting with. It's not our staff, it's not our customers, it's not even other stakeholders like shareholders. But it has to be much broader. The local communities that we serve, the wider community who may be impacted. So we started thinking quite deeply about kind of what we can do for those broader communities, and it's not just kind of a nice thing to do. It's actually essential.
We could see malaria deaths double over the next 12 months due to the disruption to vector control, to test and treat, to case management. Doubling malaria cases would take us back to a global death toll we haven't seen for 20 years. We cannot let that happen. This is a crisis that could see us set back the fight against malaria by many years, or if we rise to the challenge and act together, it could be an opportunity for us to redouble and actually accelerate the progress we're making.
Climate change or environmental impact, and I would say the health crisis was not a priority. But I guess with the COVID, the whole scenario has changed, and everyone realized that when such crisis impact us, it is more than a health crisis, right? It is impacting social, economic.
Wearing masks seems to be a common measure for the people in the society. And one of the philosophy behind wearing masks is not about protecting yourself, but protecting others from getting infected. And that is a kind of mindset that we would like people in the society to have in fighting against any diseases, not COVID-19, malaria, and other diseases also.
So we're facing this huge crisis with COVID-19, and the pandemic is devastating in itself. But if it also disrupts other critical health services like malaria or other communicable diseases, then the impact from COVID-19 will be redoubled. So we can't take our eyes from these other killer diseases. To end malaria and to fight COVID, we need all hands on deck. We need governments, we need businesses, we need individuals, we need civil society. And that's why this leadership from the M2030 businesses is so important. And it's really heartening, I think, for us to see that M2030 businesses are now focusing on both malaria and COVID. It's not sort of it's not a choice of either or. It's doing both essentially. Partnerships are critical for resolving almost any global development challenge. We need to do so effectively, I think we need partnership platforms to really harness that power. And M2030, of course, is one of those platforms, and we're always open to more partners